Hello, I'm Dr. Ruth Bernstein, Regional Director of Psychological Services at Hopebridge.
Hi there, I'm Dr. Wendlandt, Regional Director of Psych Services.
Young children are in a critical window of development, which means that children who need diagnostic evaluations and intervention services, time is of the essence. That means we need to get them in as young and as quickly as possible. Telehealth diagnostic services get children in faster, reduce wait list times, and also parents get to have the entire evaluation from the comfort of their own home. This also means they're reducing travel times. So for some families, we're talking about not having to travel 2 hours to get to a clinic.
Using video technology is something that Hopebridge really supports so that we have the availability to service those families that are in the outlying areas or even close to the center but have difficulty maybe getting to that center. And they don't have to pack anyone up into a car and come into the center. They get to be seen right there in their home where they are. Not a new use of technology, but a refined use of technology that we at Hopebridge are capitalizing on.
Virtual autism evaluations have 3 main components. So the first piece is a caregiver interview in which we ask you about 500,000 questions. We love to be able to watch the kiddo play during that time, and then it feels a little less awkward for you. The next piece is the assessment piece. That piece usually feels pretty awkward. We might get a little bossy and kind of tell you what to do. We're not judging you, we just need to see how your child responds to different prompts and how they play. In the last piece, we're able to tell you whether or not your child has autism and give you some brief recommendations.
As with all services at Hopebridge, we tailor them to meet the specific needs of that child. And the diagnostician or the evaluator that you'll be working with will determine whether a full evaluation can be done on a telehealth platform or if coming into the center is going to be the best for that child. The one advantage that we have doing it telehealth is that if your child gets more interested in the person whose face is on the screen, we can shut our camera off and still have the observation of the child in their comfortable environment. We don't have that ability when we have an in-person evaluation. But at the end of the day, the decision to continue with or completely do all of the evaluation procedures via telehealth versus in person will be between you and the evaluator.
The entire evaluation takes approximately 2 hours. That includes all 3 components: the interview with the parent, the actual testing, and the feedback piece. The testing itself can be pretty quick and sometimes only take about 15 to 20 minutes. That can feel a little fast to families, but it's normal. The reason is that in-person testing takes a bit longer because it's an unfamiliar environment and your child's interacting with an unfamiliar adult. In telehealth testing, it's a familiar environment, you're in your own home, and your child is interacting with you, a familiar caregiver. So there's several pieces that we're able to just sort of take out and get to see the symptoms we need to see much faster.
Well, it's not actually necessary to come into a center and be seen face-to-face at the center to be diagnosed with autism. The process that we use for our telehealth services is the same as if you were in person. So we're going to be doing an interview, we're going to be providing testing, and we're going to be then observing your child. The good thing about the telehealth services is that we are able to see that child in their home environment, so you don't have to round them up, get them into a car, travel to the center, go to an unfamiliar environment, meeting with people that are unfamiliar to you. We get to actually see them where they are in the home. And like I said, the instruments that we use are very consistent with those that we use in person. The process that we use is the same at the end of the day, and it doesn't compromise quality in any shape or form. We are able to make a diagnosis of whether your child does or does not meet the criteria to be diagnosed with autism.
Telehealth evaluations are a fast, efficient, reliable way to do diagnostic evaluations for autism really quickly when your child needs it. please reach out to your provider or contact Hopebridge for additional information.
At Hopebridge, we want to provide options. We want to do what is best for your child to get you the answers that you've probably been long waiting for. Please speak with your pediatrician or reach out to us if you have any additional questions. We'll be happy to talk to you.